Do you sometimes feel like your body just doesn't listen to your brain? Like when you try to tie your shoelaces and your fingers fumble too much. Or maybe you spill drinks, often even though you're being careful. If yes, you're not alone. Some people struggle more than others with basic movements like running, writing, or even catching a ball. This could be a sign of developmental coordination disorder, DCD. DCD is not about being lazy or clumsy. By choice, it's a real condition where the brain has trouble sending the right signals to the body to do smooth, coordinated actions. Think of it like trying to control a video game character with a laggy controller. You press the button, but the action is slow or wrong. Kids with DCD often look clumsy, but they're trying their best. It usually shows up in early childhood and can affect school sports and daily life. What causes DCD? Well, scientists believe it's mostly about how the brain develops, especially the parts that control movement and coordination. It's not caused by an injury or illness like a fever. Instead, it's thought that the brain's wiring, how nerves and brain areas connect, isn't quite matching up during early growth. Imagine building a toy robot where some of the wires are attached to the wrong buttons. Even if the robot's parts are fine, it won't move right. DCD often runs in families, so if a parent or sibling is clumsy, a child might be more likely to have it. It's not caused by lack of practice, but practice can definitely help. Other factors like being born early, premature, or having low birth weight may also play a role. Importantly, DCD is not linked to intelligence. Many kids with DCD are very smart, but just struggle with physical tasks. You might ask, how do I know if someone has DCD? Let's play a quick game. Think of learning to ride a bike. Most kids get the hang of it after a few tries. They balance, pedal, and steer. But a child with DCD might keep falling, not because they're not trying, but because their brain is having a hard time combining all the movements. They may also write very slowly, with messy handwriting, or avoid activities like catching a ball, climbing, or using scissors. They might seem clumsy, bump into things, or take forever to get dressed because buttoning is hard. At school, they may avoid gym class or seem frustrated during art or writing time. Importantly, these problems aren't due to other conditions like cerebral palsy or vision problems. The child tries hard, but the coordination just doesn't come naturally. These signs usually appear before age 5 and can affect confidence and social life too. So, how is DCD diagnosed? It starts with noticing the signs. If a child is struggling a lot with everyday tasks, parents or teachers might talk to a doctor. The doctor won't do a blood test. Instead, they watch how the child moves. They might ask them to do things like hop on one foot, copy shapes, or walk in a straight line. A specialist called an occupational therapist or physiotherapist may help test coordination, balance, and motor skills. To confirm DCD, the child must have real difficulty with motor skills that affect daily life, and it can't be explained by another medical issue. Once diagnosed, treatment is all about support, not a cure. Occupational therapy helps kids learn tricks to handle daily tasks, like using pencil grips or dressing aids. Physical therapy improves balance and movement. Teachers can help by giving extra time on writing tasks or letting the student type instead. The goal: build confidence and skills, step by step, like learning to use a new app one feature at a time. Can DCD be prevented? Right now, we can't completely prevent it because it's linked to brain development before or just after birth. But we can help reduce its impact early on. Think of it like watering a plant. We can't control its genes, but good care helps it grow strong. For babies and toddlers, lots of play that builds motor skills like stacking blocks, drawing, running, or playing in sand helps the brain and body connect better. Early identification is key. If a child is struggling, early getting help from therapists before school starts can make a big difference. Supportive parenting, encouraging effort over perfection and teamwork with teachers and doctors also matter. While we can't stop DCD, we can create an environment where kids learn to thrive despite challenges. Recent research is giving us better tools to understand and support DCD. Scientists are using brain scanning to see how the brains of kids with DCD process movement differently. Some studies are testing video games and apps that train coordination in fun ways, like playing a game that helps hand-eye coordination using a tablet. New school programs are being tested where teachers learn how to spot early signs and adapt lessons. There's also growing awareness that DCD doesn't disappear in adulthood. Many adults still struggle, so researchers are now looking at lifelong support strategies. One exciting advance is motor camps, fun, camp-like programs that help kids practice skills through play. The message is clear: DCD is gaining attention, and with better tools and understanding, people with DCD